Peripheral artery disease (PAD) is a cardiovascular disease. Look at this. Picture shows that crucial limb ischemia, angiography findings, and ultrasound. Detail going on. Introduction. Peripheral artery disease is a common circulatory problem in which narrowed arteries reduce blood flow to the limbs. It primarily affects the arteries in the legs, but can also impact the arteries that carry blood from the heart to the head, arms, kidneys, and stomach. Definition. PAD is defined as a condition characterized by the obstruction of large peripheral arteries resulting in either acute or chronic ischemia. A restriction in blood supply to tissues caused by atherosclerosis, inflammatory processes, or thromboembolic events. Types. 1. Atherosclerosis PAD caused by atherosclerosis, buildup of fats, cholesterol, and other substances in and on the artery walls. 2. Thromboembolic PAD caused by blood clots that travel to the peripheral arteries. 3. Inflammatory PAD caused by inflammatory conditions like vasculitis. 4. Functional PAD caused by conditions like Raynaud's disease, which causes the blood vessels to spasm. Causes. 1. Atherosclerosis, the most common cause, where fatty deposits build up in the arterial walls. 2. Blood clots can block arteries and restrict blood flow. 3. Injury, damage to the arteries. 4. Inflammation, conditions like vasculitis that cause artery inflammation. 5. Radiation exposure can damage blood vessels. Risk factors. 1. Age. Risk increase with age. 2. Smoking significantly rise the risk. 3. Diabetes increase the risk of PAD and other circulatory issues. 4. High blood pressure damages the arteries over time. 5. High cholesterol contributes to the formation of blocks. 6. Obesity increases strain on the circulatory system. 7. Family history, genetic predisposition, complications, critical limb ischemia, severe obstruction of arteries which markedly reduces blood flow to the extremities. 2. Infection. Reduce the blood flow can lead to infections. 3. Amputation. Severe cases may necessitate removal of the affected limb. 4. Stroke and heart attack as a result of the underlying atherosclerosis. Pathophysiology. PED occurs due to atherosclerosis, which involves the formation of blocks within the arterial walls. These blocks are made up of lipids, cholesterol, calcium, and cellular debris, which can restrict blood flow. The reduced blood flow causes ischemia, leading to symptoms of PAD. Signs and symptoms. 1. Intermittent claudication, painful cramping in the hip, thigh, or calf muscles after activity. 2. Numbness or weakness in the legs. 3. Coldness in the lower leg, foot, especially when compared to the other side. 4. Sores on the toes, feet, legs that would not heal. 5. Color change in the legs. 6. Hair loss or slower hair growth on the feet and legs. 7. Slower growth of toenails. 8. Shiny skin on the legs. 9. Weak pulse in the legs or feet. Diagnosis. 1. Physical examinations, checking for weak pulse in the legs. 2. Ankle brachial index, ABI, comparing blood pressure in the ankle with blood pressure in the arm. 3. Ultrasound to visualize blood flow. 4. Angiography using X-ray imaging to view the blood flow in the arteries. 5. Blood test to check for diabetes, cholesterol levels. Nursing diagnosis. 1. Ineffective peripheral tissue perfusion related to reduced blood flow. 2. Chronic pain related to ischemia. 3. Impaired skin integrity related to poor circulation and wound healing. 5. Activity intolerance related to pain and weakness. 5. Risk for infections related to poor wound healing. Management. 1. Lifestyle modification, smoking cessation, healthy diet, regular exercise. 2. Medication, antiplatelet agents, cholesterol lowering medications, medication to improve blood flow. 3. Foot care, important for preventing complications. 4. Revascularization, procedures such as angioplasty and bypass surgery. Treatment. 1. Medications to manage symptoms and prevent complications. 2. Surgical interventions, angioplasty, stenting, atherectomy, and bypass surgery. 3. Exercise therapy, supervised exercise programs to improve symptoms and increase walking distance. 4. Lifestyle changes including dietary modification and smoking cessation. Psychosocial medicine. 1. Impact on quality of life. Chronic pain and mobility issues can affect daily activities and mental health. 2. Support system, important to address the emotional and psychological impact of PAD. 3. Patient education on managing risk factors, medication adherence and lifestyle changes. Prevention. 1. Healthy diet rich in fruits, vegetables and whole grains. 2. Regular exercise to improve circulation. 3. Smoking cessation to reduce the risk of PAD and other cardiovascular diseases. 4. Managing chronic conditions such as diabetes, hypertension, high cholesterol. 5. Regular checkups for early detection and management of risk factors. In conclusion, PAD is a significant health issue that requires comprehensive management including lifestyle modifications, medical treatment and surgical interventions when necessary. Early diagnosis and treatment are crucial to prevent complications and improve quality of life for affected individuals. Patient education and psychosocial support play essential role in managing PAD effectively. Thank you. Have a good day.